Okay, and welcome back to Student 2MP. My name's Mark.
And I'm Heather.
And welcome to our fourth podcast.
Yeah. So I apologize. I have a croaky voice today. I'm getting over a cold.
Yeah. And I just got out of work after 12 hours on an urgent care shift, and it wasn't bad.
Yeah, it's kind of waning down now because flu season is winding down, so that's kind of a relief. I know a lot of our providers are breathing a little bit better.
Mm-hmm.
Yeah.
And by the way, I've chosen to drink a beer on this podcast.
Yeah,
so.
that was a big deal. Do we show the label or do we not show the label?
Yeah. Are we big enough right now in the podcast world?
So we're promoting the non-labeled beer.
Yeah, and someone isn't drinking here, and don't let Heather fake you out. There's beer in
my mug.
In this mug. I'm not gonna let her get away from it.
It's late at night. We can have a beer.
Yeah.
Yeah, it's after shift. Cheers.
Cheers.
Yeah.
So this brings in our guest of the week, and this is Brandy.
Hello.
Hey, and I'll let Heather introduce Brandy.
So Brandy is one of our newest NPs that works with us in urgent care.
Yeah.
And I actually got to interview her, and she was like the best interview ever. It was so much fun. So we had interviews throughout the day that day, and we had breakfast, lunch, and more lunch, and then we said, I really hope this dinner interview is going to be great because we have to spend, it was almost 2 hours, right?
Yes.
And it was so much fun. You were the best, most fun
Thank
interview.
you. Thank you.
Yeah,
Thank
it
you.
was really great. So you could actually give NPs tips on how to get their first NP job if you ever wanted to do that.
Yes.
But so Brandy's been with us for...
Since February.
Yeah.
So
And I don't
2
know.
months? About 2
It's
months.
been 2 months.
February 19th,
Yeah.
so a month and a half, almost 2 months.
Have you had any experience? I don't know you as well as Heather knows you, but have you had any experience prior to this job as an MP?
6 months experience doing ortho trauma.
Where did you go to school?
I went to the school at South University.
South University
The
in
Tampa campus.
In
Uh-huh.
Tampa,
So it
Florida.
wasn't online. It was like an actual campus.
Yes, it was. I went on campus.
And do you recommend South University?
Yes, I had a good experience
Okay.
at South University.
How long was it?
A 2-year program.
Okay.
We've talked before about like online versus in your face kind of brick and mortar schools, and
I think my bachelor's, I did that online. I like being in person so much better.
Mark too.
I'm the same way. I went to University of Tampa. It was similar. But now that you graduated, you went into ortho trauma. I'm curious about that.
So
Sounds fun.
yes, it was fun. My background is ER, and before I became a nurse, being an ER nurse, I was surgical tech, so I worked in the OR. So ortho trauma was like really exciting. It was a big part of that, but fortunately, I lost that position because I worked for a private group and I lost funding for my position. So
you didn't want to leave.
No, I actually liked it. I was starting 6 months is when you were starting to get the hang of things, you know, you're starting to finally learn. And then when I knew I was losing that job, I actually, as a new grad, I was like, I don't know what I'm going to do. Like I was doing part-time work with a ER as a nurse practitioner that another nurse practitioner helped me. But it's over like 100 miles away, so I was only going out there like once or twice a month. And I was still gaining experience.
Yeah.
So it was pretty scary, and I started to realize like they don't teach you that stuff about private groups versus non-profit groups and
so
things
much.
in school.
Yeah.
So then I was like,
I still don't know that information. I'm a little scared, honestly.
Yeah.
Okay.
Yeah.
So
what did you learn about that, actually?
So the group that I was working with is a private group, so the ortho trauma portion of that group got paid from contracts and grants and funding that from people that fund that program.
Okay.
So they pay all their residents, because working on trauma center you have residents and other people that are from different colleges, so they have to pay them, but it gets funded by contracts that they have with either schools or other places.
Makes sense.
And then
almost like a hospital would work. You know?
Yeah, it's almost like each doctor, there's only a certain amount of shareholders, and then all the physicians pay for their own NP or PA out of their own pocket, out of their own money, their own
Oh,
budget.
that's so different. I've not heard that
Yeah,
before.
so it's very different working for a private group versus at the hospital. You're just kind of under a whole big
Sure.
umbrella group.
So with that private group, was there a physician that sort of paid for you out of his pocket, her pocket?
So yes,
Really?
that's basically
Wow.
how.
And then you lost your funding.
Yes.
How long did you actually do it for?
6 months. 6 months I was doing the ortho trauma, but it was definitely a good experience. I'm not mad at the group or anything.
What'd you do? Because I would be like ortho trauma. Like even if I was an ER nurse, like ortho trauma, like as an NP.
Since the group has a lot of residents, because a lot of residents come and train, so basically I saw the patients before and after surgery. Well, traumas you can't predict. So a trauma would come in, and if there wasn't like a resident available, then I could go down there to the trauma bay, assess any ortho injuries. If there was a resident, they would see that, decide if the patient needed to go to surgery or whatnot. Once the patient went to surgery, then I usually took care of them on the floor. It's mainly make sure that they were set for discharge, make sure that their medications post-operatively were okay. If it wasn't like an initial trauma and they can have their surgery later, then I made sure their consent forms were signed.
Wow.
Like you usually work with a lot of other services like
Sounds on call
trauma.
because of the trauma.
Actually, since we had residents, they took call.
Oh,
So
wow.
the
High
NPs
five,
didn't.
Yeah.
So the NPs didn't have to take call, which was really cool.
Nice. What were your hours when you did that? Were you doing 12?
Monday through Friday, 6 a.m. actually to like 3.
Wow.
Basically, you kind of work till the work is done, and I worked with like 2 other people, so we got the work done pretty much done at 3 o'clock.
Okay.
Nice. Do you miss that? Because now you're in 3 12s. Well, we're doing sort of 2 12s and 2 8 or 2 6s with you sometimes. So, what do you think?
I actually liked coming back to the whole
You
3
did,
12
'cause that's what
hour
you're
shift.
used to.
I like
Yes.
it too.
Yeah.
I like it too.
So
I
I
don't
was
want to leave
like-
ever.
Yeah.
I
love it.
miss having that day off during the week.
Yeah,
a couple
2
days.
days off.
Yeah.
Right? For if you work 5 days a week,
Mhm.
right?
Exactly. So I do like the 12-hour shifts more.
So the urgent care was sort of a fit for you when you were looking for something else.
Yes.
Yeah.
And it was still a mix between, because primary care I haven't did, and so it was still like having some ER and a mix between it not being ER, because most
Right.
people who have been in ER for a while kind of like, I want to change, I want to get
Yeah.
out. So
Yeah.
it's a
It's
good
a little
change.
less intense.
Yeah.
Yeah.
Yes.
Are you still getting the procedures that you like? And
Oh, more than
More
than
more?
usual.
Sometimes
yeah.
it's too much,
Really?
right?
Yeah.
You're like, okay, here we go again.
Yeah.
Well, you're just not used to being the provider yet, right?
Yes,
is that
that's-
what it is?
That's true too.
Yeah.
So it's all
is
still
that
new
hard?
to me.
Because this is so what was the biggest, because you've been doing it for 2 months now, so what was the biggest transition challenge for you from going to what you were to this?
Being making the diagnosis myself, knowing that I'm the one that's telling somebody
Yeah.
what it is, and coming up with the treatment for it, and knowing that I'm correct, it's okay. And
So, and when I said I couldn't believe how much independence I had when I came to an urgent care, like they just, here's your own business, here's your own urgent care, go for it, you run it.
Yeah, well,
Was
if you're
it-
by yourself, right?
If you're by
Mhm.
yourself. Was it like that in ortho trauma too, or you always
No,
have there because
we
someone always
already-
covers you,
Exactly.
right?
So most of the orders and stuff were put in by residents prior to them
So
putting
you
forward.
didn't
So
have
it
to
was
make
kind
your
of
own
like
orders.
overlooking, double
Yeah,
checking.
that's what. And that's
Almost like
what I
double
saw
checking
last
to
week.
make
Yeah.
sure things are going like what the doctors and
Yeah.
stuff already
Make
kinda
sure you're
said.
following the protocol and everything that's already laid out. So here you're laying out your own protocol.
Yep, doing my own.
You're in charge,
I was
right?
with you. I was with her the first few days, and you never let on that was a challenge for you.
Oh no,
You
I still feel that way.
You went in the room and you owned it, and you were like,
Wow.
"Hey, so I'm Brandy."
I
and
hope
this
you
is
thought
what
that
you
about
got."
me too.
Yeah, of course.
Oh
of
right,
course.
I don't know
But I'm not
about
interviewing
this.
you today.
Yeah, oh no.
It's
Mark-
still
Mark
a little
owned it.
nervous.
No, I
Some
definitely had
challenging
trouble.
patients. Yeah.
You definitely have ER experience, so this job comes much easier. And we have another new provider who started in the ER. I just feel like they have a leg ahead. They've
Yeah,
seen
exactly,
things before.
yeah. And
I
so-
think what makes it more comfortable is the fact that I don't have a problem speaking with people
Right.
or introducing
A good bedside
myself
manner.
or
Yes.
yeah. So I think taking that part out of it, then I can concentrate just on the medicine.
I do think that because I've worked with some new PAs, right, and they don't have. I love PAs. We have some fantastic ones, but their baseline isn't what we have. So as RNs, right, we've been in the hospital and we have that comfort level with patients. We've seen all the everything, naked and not naked, and running down the halls, and it doesn't faze us. And so going in there and talking to the patient that's just, we've got that.
Yeah.
And then so it's really the medicine portion that we get. Yeah, that we have to master. So I feel like we have a little bit of a leg up.
We're lucky as nurses. We have that experience. Now the nurses that go straight from nursing school to becoming an NP.
True, they don't have that.
They don't have
there
that.
are those programs now, right?
Exactly.
Right from RN to NP.
And I've noticed that in some of the, and not to take away from those nurses because everybody's very different.
Or PAs either because they're fantastic. There's
something to be said about a nursing experience, just dealing with patients. And honestly, I didn't know what I was doing when I first started, and you kind of just wing it. But the way you perceive a patient, because you've been a nurse, you've cared for a patient, is just so, like, you know every situation that could come.
And you've got that comfort level, and it's
I don't think it makes it easier, though.
So the assessment part is down, right? You got
the assessment. I think the biggest difference is in the ER, I have like everything at my disposal. I can run every test and do everything. And the urgent care is kind of scary because it's like, what can I do to really rule out that? So I have to be confident in what I'm,
And I would think that transitioning to any other role. So if you went from here, say you worked here for 50 years, like we want you to, and then you go to a different specialty, say even dermatology, you're going to have to learn, what can I do in that office? What can I do? What answers can I get right now? What can I send out?
Exactly.
I'm sure that you would have that everywhere.
I think you touched upon it. It took me a long time to figure out what I can refer out and what I can't. What I can manage and what's appropriate to I'm going to start this right now, and then we'll deal with this later.
And I would think that applies to any, except for maybe the ER. I would think that applies to any specialty that you're going into, right?
Well, once you're in a dermatology, it's like you better do everything for that skin.
Right, but I'm sure that you're still referring to surgery, and I'm sure you're referring to ID and primary care. And,
that makes sense.
Oh, for sure. Yeah. Yeah, absolutely.
So, what is the most challenging part of the urgent care experience you've had so far? Or, like, where are you? And, like, is there something where, like, I'm not quite confident right now?
I double check and probably triple check my peds dosing. And it's like, I'm like having the problem where either under or overdose.
Right? Until you realize amoxicillin cures all. No, I'm just kidding.
So what's really cool is, I'm training her on the EMR system that we have, and she's like, hey, don't you know that there's this peds calculator right here?
I know,
dosing, and I go, no, that's so neat.
And I use that. I use my Hippocrates dose calculator.
Yeah, I use that.
And I think I even, and I have my little ER little book, and I check the dosing on that, so I have like 3 different.
I know. I think kids will always scare me. So today, during work, I had it was a 3-year-old, maybe a 2-year-old, nope, I'm sorry, a 13-month-old come in with a laceration right here. Oh. And it was a gaping laceration. And I'm just sitting here like, I can do sutures, but I feel uncomfortable dealing with the mom and dad and wrapping them up and make sure everybody is comfortable. And Dr. Weir, who has 40 years experience, thank you, Fast Track Urgent Care, for hiring Dr. Weir. He's amazing. He's like, I got this. Come with me. I'll show you exactly what's going on.
Oh, that's so nice.
He's amazing.
Oh, that's great.
So he showed me how to like comfort the patients and believe me, when I'm at my own clinic, and I held their head, right? And they're screaming and fighting the whole way. Yeah. And it's a lot harder when you're by yourself as an NP at a clinic by yourself.
Right. But you're never really by yourself. I mean, you've still got...
In those situations where you have a laceration of a 13-month-old...
You've got an MA who can hold it down.
You're right. True. You have an MA, but those situations still scare me. It's not about the care anymore. It's just about how can I make everybody happy in this situation.
Right. Yes. And then if they're I feel like if the room is calm and the kid isn't screaming, then I'm calm and I can suture better. If that kid is screaming, I want to do it faster,
I
and
know,
the parents are
exactly.
tense.
That's right.
Yeah,
You know? And they're like, you're,
even
but
though I
Dr.
know
Weir knows
it's
everything the
numb
right
and-
thing to say. It's like, oh, you're fine. And I'm like, yeah, the 13-month-old doesn't know you're
Yes.
saying that, but you just do it for.
So do you
You
stop
just
screaming?
talk to them
Yeah,
as
you're
a person.
talking-
I think
exactly.
like they would
Yeah.
understand.
And it's like, oh, it's okay. You know, he's all numbed up right now. We got the
I know, he's
lidocaine.
so great.
you know.
So did he stop screaming?
Yeah,
Yeah.
it worked out great. I mean, it was 3 sutures. It took a while. I mean, to get 3 sutures in a 13-month-old, but I mean, the outcome was great.
Did I ever tell you the trick that I learned with the little kids about tying it up?
No.
Okay, so this was really cute. So I had this, I don't know, he's maybe 3 years old, and he had a lac kind of up here, kind of like your kid, up on the forehead, and it really needed to be sutured. His whole family came in with him. It's like 5 family members in there, and the kid was screaming and crying, and I said to the mom, you know, I mean, this is urgent care. I'm limited to the manpower that I have to hold your kid down. And so we'll do the best we can, but if he's really, really unruly, we may have to send him to the ER, but I'm going to try not to. And she's like, we got this. There's 5 of us here. We'll help hold him down. It'll just be what it is. And I said, okay, as long as you're on board, that I promise I'll get him numb, but sometimes they cry even after they're numb just because it's scary. So I put the lidocaine cream on there. We waited the 10 minutes. We got everything all fixed up, right? And I put everything to the head of the table so that the kid can't see it. And we don't drape the face because then it freaks the kid out. So I'm putting I numbed it up, and that freaked him out because that's painful, right? And it burns and everything, and he's crying, and then he stops crying, right? Because I'm done with that part. And so he's numb, and he's talking to his parents, and they're showing him a little video on the phone. And so I'm throwing my first stitch, and he saw the string, and he said, oh, there's no more needles now? You're just tying me up?
Yeah.
And I said, yeah, I'm just tying you up now. I'm just going to tie it together. And he goes, oh, good. I'm so glad there's no more needles. And I realized after that's what I tell the kids. Now, if they can't see it, they don't know under the chin and up in here and on the head. They don't know that we're actually sewing them. They only feel the first needle. So I'm like, it's okay. It's all done with the needles. I'm just going to tie you up now. I'm just going to tie it up because that's all they see is the little string because we're not draping them, right?
I know. And it was good that a 13-month-old can't fight you, right?
Yeah.
The problem when it comes to the 3-year-old, they're fighting.
Yeah, right. The 3-year-old has a lot more muscle power. So.
And at that point, I'm just like, maybe I give in too easily, but I'm like, ER referral. I can't do this.
Yeah.
I can't do this. Like,
especially if the parents can't hold them down.
And if the parents are, like, I'm not our baby. Like, no, this can't happen. And they're anxious, right?
Yeah.
But today, the parents are like, oh,
that's great.
I gave birth to this kid.
I think
I
Dr.
can
Weir
handle it.
there, anybody would be
Oh
fine.
my God. Dr. Weir is.
Have you worked with Dr. Weir?
Oh, yes.
Oh, yay.
Think of Mother Teresa in male form. Like,
We try to put all of our new providers with all of our wonderful doctors so that they get that nice experience. Yeah. So Brandy was with me. We were working together recently, and we had an emergency. And without like a HIPAA violation or anything. So Brandy, we had one of our employees have a seizure, and right in the clinic.
Wow.
And so right in front of her door, so she
I was in a room with a patient.
Wow.
With the door closed,
and
and the seizure happened right in front of the door, right? Maybe a couple feet from the door.
You didn't see it though; it was behind the door.
Right.
Yeah, because I was in the room with the patient.
And she opens the door, and of course we're managing. Me and the other medical assistant are managing the scene, right? And we've got the little crash cart, and I'm getting a pillow for her head, and we're checking the time of the seizure and all that, right? And so Brandy has no idea what she's walking out to, and any other.
I got your plan of care, family. Here we go.
Any other brand new NP would have opened the door and said, oh my gosh, and freaked out. And Brandy opens the door, and I look at her, and she looks at me, and she goes, and she's just smooth as heck. She says, come on out this way. And she guides the patient. And she's like, come on out this way. I don't even think that patient saw that everybody had a seizing employee on the floor. It was awesome. It was so awesome. She just guided the patient out, and they checked her out. And then Brandy comes back and is like, let's call 911. And it was
Brandy
fabulous.
needs to give out her email address and phone number. She's about to get a lot of job opportunities.
I love the fast track.
Okay.
I love the.
Well, you've worked now independently by yourself.
Not
yet.
This week?
April 1st.
Yeah, next week.
Yeah, next week.
What did you get a call from somebody about that, or did they just schedule you? How did it work?
Did Heather call her and say,
Well, I'm on the schedule.
You're on the schedule, so you just looked on the schedule? Because to me, the manager...
Oh, yeah, because we were talking about credentialing. And I was more concerned about, will I be credentialed enough to go out there?
Because because the DOT website is down. So even if they take their test, they can't take their test now.
We're not even allowed to take the test.
So you just saw the website's
down.
Yeah.
So when you saw that date on your schedule, you're like, oh, I'm by myself. Like, what was your like? Are you okay?
Yeah.
I know you're okay, but what do you think about it? Where are you in?
I check the patient counts probably every time I'm on shift to see how many patients come up there.
Yeah.
To see how many. I'm like, okay.
What's the most you've seen with because you've been working with another provider the whole time? So what's the most you've personally seen so far?
I think it's ranging from 20 to 28. I think the highest was the one time here at South Tampa.
That's a lot.
But the averaging has been like 20. I'd say the average.
You'll notice, at least what I noticed is there's a big difference, and not to scare you, but there's a big difference between 28 here and 28 by yourself.
Yeah.
There will be.
Just because.
Oh no, she's gonna be fine.
But I see
the people, she's gonna rock it.
But I want you to know, like, you got to deal with telephone encounters and all the questions that come because you're going to be dealing with new clinics where MAs don't have that much experience. So all of a sudden,
now
you're
I'm feeling like I need to go up and work with her too.
No, it's fine because that's what you'll be okay because you've been in South Tampa and you're like, no, they don't do this at South Tampa.
Yeah.
They don't do this at like clinics that I've been at, and those clinics just don't have the experienced people sometimes. And you're like, okay, we're gonna figure this out together because.
I'm like hoping I don't get anything crazy because sometimes like ER people refer, I'm the black cloud and that's why it's like blowing up or something like that.
So what's crazy? What are you worried about? What's your crazy that you're worried about?
Well, I don't want anyone to get mad that I'm not DOT certified yet because of the and we'll have to like probably redirect someone there. But I'm not sure if I've seen a lot of DOTs check out.
That I like that answer because that is doable. That's not out of your control. So there you go, right? You can say out of my control.
Everything else, everyone's like a phone call away.
Right.
Yeah,
so
it's almost like a nursing job. Like, yo, doctor, what's going on? That's in a weird way. This is like a nursing job, but the people who.
So much better.
But I know. It's like I always have a doctor at my line, but I'm in control of everything.
Oh, that's true because in the hospital you're consulting with a doctor about things. So, right? Hey, I need this or I need that. Right? And this patient is doing this.
Can't I say that about every nurse practitioner job? It's the same thing as a nurse. You always have a doctor at your disposal in the good jobs.
In the good jobs, I was going to say there's some crappy jobs that I applied for where there was no physician help at all. So this is nice.
I'm glad we have physicians.
Yeah,
I know. I'm glad I'm not a physician. I like being a nurse practitioner. Nothing against a physician, but I like the physician.
Yeah.
Right?
Sometimes we'll see. So nurse practitioners see horses. We are experienced and schooled in the horses, right? So there's a whole bunch of horses, and so the neat thing is that we'll see 50, and by horses I mean like sinus infections and sore throats and things like that. So we know when we see a zebra, like if it doesn't fit that horse mold, it's a zebra, and that's what we call it out. That's what I'm always calling and saying, all right, so I think I have a zebra and I think I need your help with this. And so I present the patient and I'll go, this is what I think it is, but you know all the zebras, so give me some input. What could this possibly be? This weird throat or this weird sore?
Yeah.
Or,
I have one today. I had a patient that I wanted to discuss, and this was one of the patients where I don't see very much, and her symptoms were she had been for 2 years having
2 years
burning vaginal like pain.
Yeah.
And whenever she peed, she'd have spasms, and it was irritating. She's been to urologist, primary care provider. I went into the room, and there was tears coming out of her eyes, being like, "I need help." So she was seen at our clinic a week ago, and we did a urinalysis, and everything was negative for a little blood. So we put her on an antibiotic. The culture was negative. And
we took her off the antibiotic.
We took her off the antibiotic. She went to another urgent care in that time. She was put on Azos because they didn't know what to do.
Right.
Then she came back and said, I don't know what to do. I've been at this for 2 years, but now it's at the worst ever. And I have work. The healthcare system's failing me. What do I do? I don't see this very much as a
So
provider.
you said,
And
hey,
I'm
Dr. Weir.
and well, yeah. Well, she was. I'm just like, she was starting to give up on the medical field, and through my nursing knowledge, I'm like, okay, well, no, don't let medicine fail you. Just because she's had a cystoscopy before by urologist.
Oh my
She's been to
goodness.
OBGYNs.
Oh, so she was so over it.
Yeah, she's over it. And I'm just like, doctors are all different. They're all, even though you've been to it, and she's just like, I know this is frustrating. Like, I'm in pain every night. And I'm like, don't worry, I have a physician who's been who's delivered babies as a primary care physician. And I'll ask him. And Dr. Weir's like, I got the medication for her. We're gonna give her an antispasmodic for her uterus. I can't cure her. She needs to go to a different urologist, and I suggested for her she needs to really look hard. So we think it's interstitial cystitis, which can't be cured.
Sure. Yeah.
Right?
That makes sense. Yeah.
But
it's sad that she went 2 years without that diagnosis, though.
and that's Dr. Weir's like, that is the diagnosis.
Yeah.
The assessment is going to provider because we have no cure.
Right. And the urinalysis is negative.
And the urinalysis always comes.
Yeah.
So we're going to put her on this meds. There's secondary, ways to get at these, like amitriptyline and depressants and other medications. But I told her, like, this is where it's up to you to figure out the specialist that you need to figure out.
Yeah.
It's in your hands, because going from evidence-based practice doctor to evidence-based practice doctor isn't going to help you.
So we need to follow up. You need to call her in like a week and find out how she's doing. And then we need to talk about it on our next podcast.
Episode 4.
And we need to have 5.
Episode 5.
And we need to have Brandy back and find out how her first solo day was.
Oh
yes.
My God,
Then she can talk about that, because I think there's a lot of NPs who are really intimidated. I know when I had a lot of my interviews, I don't know how many you went on before you got this job, but I went on a lot, like 6 months worth. And many of them were, hey, I want you to run my clinic while I'm way off in some other county. And I may answer their phone, or I may not if you have a problem, but I want you to just run my clinic. And that was super intimidating for me. No orientation, no nothing. And so I want to hear how your first day is. Yeah, because you've got a lot of support where.
Yeah, I think.
You immediately got that job out of school?
Yes.
Oh, yeah.
Okay, so that was an easy
search. Where was your
for
first interview?
Yeah, since after.
That's awesome.
They called
Mark too.
After I accepted, they called me back because there was another doctor in the practice that needed an MP, and I was like, no.
Oh, good.
Wow.
I'm glad you stayed. I'm glad you stayed. Good.
Wow. Yeah, high five again. Good job. So it was easy to find your jobs, right? Your first 2 jobs were pretty easy.
I think it's.
What is it?
I think if you already work in the healthcare field, you build like relationships, and you just gotta.
Did you get the job beforehand? Were you networking prior to
No,
what was your secret sauce?
Actually, I wish I kind of would have started looking before school, but I didn't want that pressure on me with the test.
Right.
So,
The national exam.
Yes,
For
I
sure.
just wanted to take my national exam and then worry about it. But it took like a good 6 months before, like, even with my other friends, we didn't look before.
Yeah.
And we were like, what's going on? Like, we were applying.
Wow.
It took like 6 months.
And did you have a bunch of yucky interviews before then, or just none?
Just basically like none really, and it wasn't just me. It was like a couple of my other 2 close friends I was close with. Them like, yes, we're not getting like any bites, and it was a lot of new grad. You're very new.
Yeah, exactly. You have no experience. Even though, how many years of ER did you have?
5.
That's a lot of experience.
So what happened? So how were you applying where you got no bites, and then all of a sudden you got a bite? What was it? What
I
changed?
think it depends if that doctor is willing to take a chance on someone new. And,
and
that's what I mainly hear.
So would you say it's like spread wide? If you're a new nurse practitioner listening to this podcast, what would you say? How would you help them, based on your experience?
Keep trying, go after it, use your resources. I had got the ER that's way out job right away because another NP worked there, and they were like, they need help right away, but that wasn't full-time, it was part-time. It was a couple of days a month because it's like it takes an hour and a half for me to get out there. So I had got that right away, but that credentialing takes like 90
Yeah,
days,
correct.
took 3 months. So I had got it right away only because I knew someone that already worked there. But for my full-time job, it took like 6 months. I just, you know, kept applying. I applied to not everything, things that I really knew I wanted. Like, I like ortho, cardiovascular. Yes, and I kept working as a nurse. And I only applied in the fields that interest me. And then
I applied for everything. I went on weight loss and tattoo removal.
Did you?
I went to chiropractors, but then I didn't accept them, and it was very discouraging. So I would go through this whole interview and then say, "That's not really what I want." It was a job offer, you know. I had like stupid job offers.
So that might have been limiting too, because I maybe didn't apply, but I didn't want to get stuck in a position that you know. And I feel like getting in something where you get a bit of everything to learn everything, and then if you decide, once you get your skills, then you could back off and decide to maybe do some like Botox or something.
Nothing against it,
but where you don't have to like, you know.
Well, I think everybody has a different personality.
Exactly.
That's what something an ER nurse practitioner would say.
Exactly. But I wouldn't mind doing that. But I wanted to make sure I had all my skill sets.
Well, you want to say, you want to be able to, like, I can go back, and if this comes up in dermatology, you want to be able to treat it. And now as an urgent care background, it's like, hey, it's like, my neck is hurting. You're not afraid to prescribe an anti-inflammatory and a muscle relaxer for that neck if they come in a different
And that's kind of what I liked about ER is that I learned a little bit about everything.
Right.
You know, so I felt really
that here. Because I feel like you're pretty confident with most of the stuff that you see. Which is good.
Yeah, as opposed to like someone, let's say they only worked in cardio, you know, then you're not going to know anything about ortho when someone comes in with like her ankle or foot. It will take them more time to learn about that. I feel like I got an overview over everything.
You know, two things I'm a year in and I have stepped down ICU and transplant experience as an RN. I'm still not confident. I'm getting more confident about kids, I have to say. I don't see pregnant people a lot, so I'm always scared of pregnant people.
Everyone's scared of pregnant people. I had to call Dr. Ding the other day just to make sure I was right.
And he's good. And x-rays. I mean, x-rays, I still miss x-rays. I'm not describing them properly of where the fracture is. I'm like, phalanx, metatarsal, I don't understand. It's confusing. Which one is above? What is it? Phalanx. No.
I grabbed my ortho book.
No, I still don't. I need an ortho book.
I printed out a lot of Google pages when I first started because my anatomy class, we didn't have anatomy in NP school. They figured you already knew it. So my anatomy was 16 years before. And so I'm here and I want to sound not like a dummy, right? And say her finger's broken. So I would spend a lot of late nights perfecting my notes and looking up the anatomy, and I googled the pages for the anatomy and printed them out, and I had my little booklet that I made. And,
did it help looking back at it?
Oh yeah, because I know them now. I'm good at it now because they're in my head. But
so I'm a year in. I need to get on this. I need to get on this.
I'm basics. Like, we see a lot of them.
I Google every time I'm there. I'm like, fibula's on this side, tibia's on this side.
Yeah, exactly.
I can't remember. I don't know.
Radius, your radial pulse, right? Yeah.
So, I got the radius.
Oh my gosh, And
like the other day I was writing a note and I was like, there's a different word to say pregnant woman. And I could not, or pregnant abdomen. That's why, because I was describing the abdomen.
Because
then I locked my note. On the drive home, I was like, gravid uterus.
Yay!
I forgot it. I was like, I forgot it. And I was like, it sounds funny in my notes when I say pregnant abdomen.
That's okay.
You say G1.
Sometimes if I don't really examine it, so I just leave it out.
You don't do GT PAL? The medical director taught me GP. That's how you start the note. I don't know if he's told you this, but he will.
That's good. Yeah.
Gravido 1.
And then just go GP woman and then you go from there. So then you know everything about it.
Yeah.
So why urgent care though? That's the one thing I wanted to ask you.
It was the split between like ER and like primary care. Even though I had split primary care, I think when you guys talked with me, you were talking about it's kind of a little primary care things, which I do see. And I see a lot of patients use us kind of as primary care, even though we try to direct them to find a doctor. But like you said, they're in love with us. So,
they are.
and it's cool to see the follow up
Yeah.
of patients, but still get that ER feeling. So ER patients, you know, you kind of see they either get admitted or they go home and you don't really see them again. Our patients, we kind of get the follow up on, which is cool.
That is neat. And not so much follow up that it's annoying.
Yes.
Primary care, I think, can be a little annoying sometimes.
I
But
never worked in the ER, but I kind of like the fact that we don't have to see the worst of the worst patients, and the repeat offenders come over and over again too. So that's the benefit of the urgent care in my mind.
Yeah, mm-hmm. This is a sweet deal, actually.
This is a sweet deal. We're gonna keep this. We're not gonna tell anyone about this. This is top secret podcast.
Top secret.
Can we name this top secret podcast?
Everyone's gonna be applying on the right?
I know, right? I actually think the Dr. Desidue, the CEO, has seen spikes in the since we started this podcast.
Lots of
How do you know when to hire on more providers?
Well, it depends if we're if somebody quits, right? If they give a 90-day notice, that's in their contract. So if they give a 90-day notice and we start looking for somebody to replace them, or if they're looking to expand, usually we have plenty of notice for an expansion, and when we decide how many providers we need, we start looking.
Yeah. I mean,
we're expanding fast.
I think that's probably an issue with the business. They're like, urgent care is hard to staff for always. So you're in busy season, you're not in busy season, and providers are mad because there's too many patients, but it's not in season, or it is in season, and you can't tell.
But I don't think that most states have busy season and non-busy season. So if people are listening to this and they're in, Vermont or New York, there's not a busy season and a non-busy season, right?
True.
Florida has this massive influx of snowbirds
every winter.
in the winter.
All the Canadians come down here.
Yeah, hospitals open up whole wings down here, which was so unusual for me as a nurse when I came down. They were staffing with travelers, massive wings in these hospitals that during the year are completely closed off, and you go through there and it's like a little ghost town. So our busy season is winter, and it's crazy busy, and I think that the state population increases by a third, and then in the slow season, like we're starting to get, almost April, and we're starting to kind of gear down towards slow season. Definitely June, July, August is slow, and we'll see a lot less numbers. But in this setting, and starting in July and August, you're going to see a massive influx of like school and sports physicals. So
you haven't been through the physical world, have you?
So
we're about to see another influx.
So you're going to see peaks in the volume again, but it's all going to be, instead of flu, it's going to be school and sports physicals.
It's a ton. They're all about 5 to 10 minutes long.
Yeah.
But you're like, wow, we saw 100 patients today.
59,
this is ridiculous.
Yeah, 59 patients by myself, and most of them were sports and school physicals.
So
you'll get it down.
Yeah, this urgent care world goes like this. I mean, the flux, 3 months, 3 months, and then after that, you were around for flu season or not?
No, end of it.
Yeah.
I caught the end.
Oh,
That's
good.
So good. You came just at the right time.
I know, that's the best time to learn. That's exactly when I came. So I came as of...
Yeah, you're at a year.
I'm at
You're
1 year.
You're
I'm at 1 year.
Are you?
Episode 5, 1 year. As of next week, I'll be at 1 year.
Good.
So
that's awesome.
And you're liking it?
I love it. I think I've grown so much in this last year as a nurse practitioner. I came on, I mean, Heather, you trained me, right? I mean, everybody trained me, right?
Yeah, everybody did. We didn't have our training program that we have now, so I would have been hands-on. Like the first few shifts.
I can tell. I can't wait. I kind of want to go back.
So sorry.
No. I went from provider to provider, and and then Dr. Nanda called me up one day, 3 months in, and was like, Mark, we're ready to release you to the wolves. And then are you okay with that? Oh, I think so. Perfect answer. And then and then he scheduled me for my first shift, and I was off.
Your first solo shift.
First solo shift. I was comfortable being an urgent care nurse practitioner about 6 months in, and then I was like that cockiness kind of like, I got this, and that was good for about 4 months, and then you go through like, I'm good, you're not really good, and then around the 10-month mark, I was like, okay, I know this job.
Sense. Yeah.
It totally makes sense.
Yeah.
And that's how long I think it takes. Just like a nurse, just like anyone else, that 1 year mark, you kind of start to grow. I don't know everything, but you start to figure out, like, I really will never know anything. But you know what you don't
But
know.
the nice thing is I think, and I tell the new grads this and the new people, that after a while, it's a different period for everybody, but after a while you get so that you've pretty much seen and treated probably 95% of what comes in the door. Oh, I've seen that. Even if it's kind of complex, you've maybe seen it before. So you're kind of comfortable with about 95%. Yeah. You've done it before. It's fast. You know the treatment plans. You know, maybe you have to look up some guidelines, but it's pretty basic. And it's that 5% that keeps things really interesting at that point, because that 5% of like complex stuff and the zebras that come in and the complex lacerations and the foreign bodies and things like that.
Like, it's like, oh, everybody's done like foreign bodies, and everyone talks about it, but I haven't done it. And it's like, everyone talks about that, but I still haven't done it. And then around the 8th month mark, you see it on the, like, coming in, like checking in, and you're like, okay, here we go.
Foreign body. And then you make a guess, where is that foreign body?
And then you're like, oh, I didn't get it this time. Like, I don't know if there's no foreign body. And then one time you're pulling out a huge needle and you're like, it's happening! Like, I figured out the foreign body!
Yeah,
like,
I've pulled a few sewing needles out a few years ago.
So how did you transition to, like, it also feels weird kind of telling the MAs what to do?
Yep.
Sometimes, like, being
it's
like, come on, like, when you
run your
like
clinic, isn't it?
That is the big difference, right? You
Yeah.
become, all of a sudden you start being like, oh, doctor, what can I do, to, wait a second, I'm in charge of everyone now.
Yeah.
And you really aren't, but at the same
are.
time you are.
You have to run the flow of your
clinic. Yeah, you really do.
And it won't run well unless you kind of see it, unless you feel ownership over it. And I think that's true for any job, right? Even if you work at Starbucks, eventually you feel ownership over your clinic and
so initially
over your store.
You're not confident in your own skills when you start in your clinic. You just aren't. You aren't confident right now in your own skills. You are enough to run a clinic, but you're still like, okay, this is entirely new to me, but I'm gonna fake it till I make it. So you've learned that skill. And then all of a sudden, 3 months in, you're like, okay, I'm doing pretty well. And then people come to you with questions, and then you start seeing new MAs come, and old MAs leave, and then
you
you're
have
like,
to start kind of training a little bit.
yeah,
right?
and you're like, wait a second, this person, I know what's supposed to happen, and this MA already trained me on strep. It's not my job, but without me knowing how to do it, this workflow is not going to go good. And all of a sudden, you realize the pain patients, the patients that if you take a while, your whole day can be screwed up.
Right.
Just from one patient. That hour and 40-minute patient screws up 4 other patients. So you know exactly the pain points of where you need to be like, I need to concentrate here right now. And this can't like screw up, or else we're going to have some problems.
And you do figure out after a while how to sort of coerce your MAs, especially the new ones who, we get an influx and it's super busy, and you kind of, after a while, you know the flow of the clinic, and you can kind of say, oh, okay, so you know what, I need you to do this, I need you to set me up for this procedure or do this x-ray, but we have 3 people waiting and I have 3 empty rooms. Why don't you just go ahead and triage and then do this, and then I'll be seeing the patients while you do the x-ray. And so sometimes they don't get that and they need that, but as a new provider, you're still learning your own stuff. So it just takes time.
And then, like, you don't want to come off as the mean provider.
You will never come off like that. You have that
Yeah.
skill as a nurse that you would never do
It's
that.
true.
Yeah.
It's true.
So,
You've got that management. I mean, because you had nursing assistants, right?
Techs,
Yeah, techs and stuff, and you would say, hey, will you come help me and do this, and let's do this, and let's plan our morning. If you had 5 patients and you had to do all these things, you would plan your day. Same thing.
Things that you won't even know. It's like you'll walk out of a room as an x-ray as the patient's going to get a triage, and you're like, before the triage, I want you to strep this patient. And they'll be like, oh, good. Like, okay.
Would you please strep this?
I mean, I gotta work on some stuff still, right? I'm only a year in now.
But they don't take offense, like, you do it yourself, and you go back there and
if you appreciate that, if you have that mindset, do they take offense? Then that's, there's some providers that don't think about that. And those weren't nurses before usually, right? That's what we have.
If you ask them nice and stuff, and like, hey, would you mind?
You've been in their role before,
would
so
you mind
you
going in and
understand
stripping that one so the test is running before you do the triage?
Yeah.
Nobody minds that.
And as a MA, they're like, yeah, that's my job. Their job is to listen to you, right? And you're just trying to you're not coming from a bad place. You're just trying to, like, I want the most efficient things for my patient. But every provider is different, and that's what you realize over your time. Like, people don't do it like me. and you're gonna find your own way to do it, and that's what's cool
Yeah.
about this, Jen.
Yeah.
But
Cool.
fun.
Yeah. So I think we're about at 30 minutes.
Yeah. Time to wrap up.
I know. Yeah.
Yeah, I know. So much fun, right?
This is fun.
Thank
Cool.
you very much for
Yeah,
joining
I
us. I
know.
think that a lot of
I'll come
people will
back.
learn a lot from you. Yes, we
We
need to
can.
have you back because I want to hear how her first day
I
went.
know.
Maybe her first 2 days.
It's been fun.
How many do you have solo? I don't think we put you on. very long.
April 1st, and then in May, I think I go to Tyrone.
Okay, that's it. Just
Ooh,
2.
Tyrone.
Okay, good.
Okay,
So
perfect.
we're easing her into
So
it.
we'll definitely have you back. We can't wait to have you back. Thank you so much for coming
Yeah.
on.
Oh, thank you
Yeah,
for
thank
having
you.
me.
Maybe people will write in. We'll let you know if they do.
Yeah, I know.
Okay.
And everybody write Brandy Grill rocks.
Yes.
Brandy is the best.
Yay.
All right, well, thanks from the Student 2MP podcast for listening, and we'll see you next
We'll
time.
see you next time.
Thank you.
Yeah.
Bye, guys.
Bye.